Hello, my name is Jacqueline Jankaew. For this presentation, I will be presenting a proactive health communication portfolio. For this presentation, I will be talking about a county at risk, details of the subpopulation, health risks, crisis, and the promotion issue, the health theory or concept that I have added, and the health promotion communication plan. I have chosen to present on the County of Los Angeles in the state of California and the African American ethnic racial group as my subpopulation. The County of Los Angeles ranks 23rd of 57 in health outcomes. That includes length of life and quality of care. The County of Los Angeles also ranks 34th of 57 in health factors. This includes health behaviors, clinical care, social and economic factors, and the physical environment. From the County Health Ranking site, I was able to collect more information on the African American ethnic racial group. Between other ethnic and racial groups, Asians, Hispanics, and whites, the African American group had the highest number of premature deaths at 9,700. They also had the highest poor physical health days at 4.7 average. They also had the highest poor mental health days at 4.4 average, and the lowest birth weight at 12%. After the Hispanic ethnic racial group, the African American group were at 16% with poor or fair health. The median household income for African Americans is the lowest among Hispanics and whites at $41,633. From the County Health Ranking site, I was able to collect some statistical data. The African Americans are less healthy than those living in the bottom ranked county. They are also ranked the worst compared to American Indian, Alaska Native, Native American, Hispanics, whites, and Asian Pacific Islanders. Between 20 to 40% of African American children are living in poverty. They are the second highest group with children in poverty after American Indian, Alaska Native, and Native American. African Americans are one of the racial ethnic groups with the lowest in educational achievement. High school graduation rate is between 60 to 80%, being the lowest group. African Americans also fall in the category of racial ethnic groups in California that are uninsured. Almost 10% of African Americans are uninsured. The teen birth rate between African American racial ethnic groups falls between 20 to 40 per 1,000 births. African Americans have the second highest teen birth rate. The reason why it is so important to discuss that information is because good health is dependent on so many things. Poverty limits opportunities for quality housing, safe neighborhoods, healthy foods, living wage jobs, and quality education. As poverty and related stress increases, health worsens. Higher rates of educational achievement are linked to better jobs and higher incomes, resulting in better health. Education is also linked to lifespan. On average, college graduates live 9 years longer than those who didn't complete high school. Health insurance helps individuals and families access needed primary care, specialist, and emergency care. Those without insurance are often diagnosed at later, less treatable disease stages and at higher costs. Teenage motherhood is more likely to occur in communities with fewer opportunities for education and jobs. Teen mothers are less likely to complete high school and face challenges to economic mobility. Their children often have fewer social and economic support and worse health outcomes. The theory I have chosen for health communication and promotion is Jane Watson's theory of human caring. This theory explains that all persons are considered to be unique and to have life history, including social norms and experiences that generate a subjective reality or phenomenal field. During a caring occasion, whenever a nurse and another person come together with their unique subjective realities, they seek to connect to each other in the present situation. Through such relationships, humans grow, learn, and develop. Thus, both the carer and the one being cared for benefit from the encounter. We can use this theory to embrace altruistic values and practice loving kindness, instill faith and hope, be sensitive by nurturing beliefs and practices, develop a helping, trusting, caring relationship, promote and accept positive and negative feelings by listening, use creative scientific problem-solving methods for caring decision-making, share teaching and learning that addresses needs and comprehension styles, create a healing environment for the physical and spiritual self that respects human dignity, assist with basic physical, emotional, and spiritual human needs, and be open to mystery and allowing miracles to enter. This is an educational piece created by the Centers for Disease Control and Prevention, the CDC, for chronic disease prevention and health promotion. They explain that regular physical activity helps to improve overall health, fitness, and quality of life. It also helps to reduce the risk of chronic disease such as heart disease, type 2 diabetes, cancers, dementia, depression, and anxiety. They explain different types of physical activities from cardio and aerobic to muscle strengthening, and how much physical activity is needed for adults and kids. They also provide tips to getting and staying active as well. The Centers for Disease Control and Prevention, the American Heart Association, the Diabetes Association, and other professional organizations do a great job at creating educational pieces for the public, but it is extremely important that we get the public involved and informed. The way to help promote communication with health and the promotion of it is to invest in the education from early childhood through adulthood to boost employment and career prospects. Health education and promotion for all ages is extremely important. We must also promote health literacy by providing students with current, comprehensive health education. It's also very important to enhance efforts to meet standards for health physical education. We also must address childhood obesity with a strong emphasis on physical activity and nutrition. Therefore, not only creating these public displays and billboards, it is also important to get them involved in their care. We must also inform and provide resources about clinics, such as CVS Minute Clinic and Central City Community Health Center, which are within the area that are affordable medical care available, while also providing public services in the area. The goal of this presentation and this proactive health communication portfolio is to involve the community in health living and health promotion. The goal is to educate and allow equal opportunity for health and education for all populations and racial ethnic groups, allowing a chance for everyone to succeed in health. Thank you for taking the time to watch my presentation on health communication promotion.